everyone, and welcome to the Dental Designs Singapore podcast. Wait, what's it called again?
No, wait.
Hello, everyone, and welcome to the Dental Designs Clinic podcast, The Bite Angle. I'm Dr. Raskina.
I'm Dr. Amanda.
And with us today, we have Nikki Smit. She is a very experienced and wonderful occupational therapist. We're very lucky to have her. And she is an expert in dealing with dental anxiety, anxiety in general, but dental anxiety is what we're going to be talking about today. And it's a pretty important topic for us because it's something that we deal with in our clinic on a daily basis. It happens to a really high proportion of people, and it's something that, there are ways of dealing with to make your experience when you go to your dentist a lot more comfortable. So, Nikki, would you mind talking a little bit about your experience?
Sure. I feel a little bit like you're honoring me with this introduction a lot by saying that I'm an expert in dental anxiety. I would say I'm an expert in personal experience of dental anxiety, for sure. So I can definitely talk about that. And yeah, the rest of my kind of experience is around nervous system regulation and building, I suppose, a lifestyle and understanding your own nervous system and brain and how you regulate. And really, at the end of the day, something like anxiety is dysregulation. And it's when you're kind of like outside of what feels like you can contain for yourself. And so I suppose I do have a little bit of experience in that. Yeah. I think I personally, I can't ever remember not being scared of going to the dentist. You're
in front of two right now.
I am.
Yeah.
Yeah, I know.
Feels good.
I'm just being honest. I'd say that in the last, I don't know, how long have I known you? A long time. 8 years? 8-9 years?
Yeah.
Perhaps that has shifted dramatically. I would say first and foremost, the most important thing is the relationship.
Yes.
And that makes all the difference. And the funny thing is that Maria was my friend before she was my dentist.
Yes,
and I was so scared of going to the dentist that I didn't even want to see my friend as my dentist until I can't even really remember what happened. I thought I had something stuck in my teeth, perhaps. And I was messaging her. I think
that's what it was.
Yeah. And I was texting her saying, do you think that I should see a dentist about this? And she was like, you could come see me. And that whole experience was so different because Dr. Maria is so kind and gentle and grounded and very much also, I'd say, like, explains what's going to happen so that you have a clearer picture of what's coming and goes slow, step by step. And that changed everything. So I'd say I still have a lot of anxiety, but it's very different. And the thing is, it's holistic, right? Like most people who have dental anxiety, I don't know the science behind it, but my guess would be have other things that they're anxious about because that's how these things work. So, yeah.
Yeah. I think your dental anxiety has definitely come a long way from where we started. And I'm really happy about that. But it's something that, actually I notice in a really, really large proportion of my patients.
Mm-hmm.
And there are a lot of things that we can do to help. So one of the things that I think I've noticed is, yes, you're absolutely right. I think it's the relationship, but I think it's really building a level of trust with the patient where they don't feel like you're going to hurt them. Because I think that that's a really big thing based on past experiences. And a lot of the things that patients are often fearful of are things that happen to them as children. And I've noticed that usually I've actually noticed this a lot in people that are a little bit older, because I think going to the dentist used to be really different than it is now.
Yeah.
And I think they really kind of were like, okay, we just need to get this done.
Crack on.
Get
over it.
Yeah.
Grin and bear it.
So I think one of the things that really helps is, telling people what we're going to do, showing them, telling them that we can stop if they're not comfortable. And actually, I think that if you come in as an anxious patient, you might need a little bit of extra time for your appointment to get comfortable. There's also other things that we do in our clinic, for example, is like having TVs in the office, because distraction sometimes really works well. Or I ask patients to put a podcast on or listen to music, because often it's the sound as well, rather than maybe even the discomfort of the procedure.
For sure. So like I'm an occupational therapist, and most people don't know what that is, and that's okay. The name is a little bit confusing, because we think that occupation means your work, but it's really about anything that occupies your time that's meaningful to you. So we look at like the I suppose like the foundational skills that you need to participate in things. And a big part of that is the sensory component. And so obviously going to the dentist is like, whole of life is multi-sensory, but like what a sensory experience that is. Like the sounds is a huge piece of it. The touch, the lighting,
The smells.
Smells. And if you think like how sensations are wired in your brain, it's like emotion and sensation are two sides of the same coin, especially with smells. And smell can bring such memories as well. Even being like, I was thinking about it earlier, like even being in the chair, like you're not grounded, right? Like you're
floating.
Yeah,
you're floating. So your whole, and that's one of your sensory systems is
Yeah.
where am I in space?
And your necks are like...
Your
And you're
neck
also
sometimes
very
is-
vulnerable.
Exact, and the mouth is incredibly vulnerable. We have so many sensory receptors in our mouths, right?
Yeah.
So that like piece, to try and think of it, I often come at things from a sensory lens, and like knowing your own, we sometimes call it like a sensory profile. So knowing what your profile is and what things are more activating for you and what things are more, give you more ease in your nervous system. And like another piece of it is that past experience. And sometimes we have memory of them and sometimes we don't, right? Like I don't have to know what happened to you to support you. Like it's not about the event, it's about what happened inside of you when whatever happened to you. And so that kind of like medical trauma, I mean, so many people experience it, and some of us experience it without being like conscious of it, right? Like some of the, like I definitely have some dental trauma from when my wisdoms were taken out and I was under, but it was a very traumatic experience. And I mean, I actually did wake up a couple of times, but I don't have like a memory of it necessarily, but that memory lives in my body.
Yeah.
So yeah.
So do you have any advice for people that are anxious about being at the dentist? Any sensory things they can do to regulate?
Sure. So when I think of strategies for anxiety and dysregulation, I really, like I said earlier, like really advocate for building a lifestyle around it. So if we think about the experience of going to the dentist, there's stuff we can do before. So I call them like little micro moments of regulation that we can build into our day before we even get to the dentist. So, and that's different for everyone, but there are some things that are like universally more regulating. So things like movement is extremely regulating on most nervous systems, especially what we call heavy work. So where you're using your muscles, it gives the nervous system this input and awareness of where we are in space and kind of that like grounding input. So getting some movement in, even if it's just a walk, especially if you can walk outside, that's going to be even more beneficial, or getting like a yoga class or something like that on the day, I would say. Things like rhythm is an incredibly regulating input on the nervous system. So that's something that you can do before. So making sure that you get like rhythmical input can be through music, it can be through movement, it can be through touch. So there's something called the butterfly hug, which is like a tapping, bilateral stimulation tapping or squeezing both sides of your arms in a rhythmical way. That's something you can also listen to while you're at the dentist. So if you've got your headphones or your AirPods in, listening to rhythmical music, or what we call bilateral stimulation music, is very regulating on the nervous system, because if I can geek out for a minute, what it does is it stimulates both sides of your brain. And the two sides of your brain are responsible for different things. So one side is more logic, reasoning, language. And the other side is more emotions and processing, like non-verbal cues. So integrating those two sides is necessary for regulation. Deep pressure touch is another one that's extremely regulating. So that's why squeezes. And you'll see, I mean, I'm holding a fidget right now, but you'll see, like, you guys will often give us little things to squeeze while we're
Stress ball.
a little stress ball.
Nurse's hand.
Even squeezing your own hands, right? So
yeah.
you're giving yourself that input, doing that in preparation and while you're there. I think all of those tools are really valuable. Touch in midline is incredibly regulating as well. It releases serotonin. So even giving yourself some of that kind of input ahead of time. And then I think about aftercare, because after the appointment, what are you going to do that's going to kind of be like a release or something nice to kind of regulate you afterwards, is really important as well. Those are kind of the things that
I actually
mind.
haven't thought about aftercare. That's a great point. So what would you suggest for after?
I always think like, I always tell my patients, so what are you planning to eat or something like that? Because at least then they can think about, if they've had a procedure, and then you can ask all the questions during that point of time. And then it also gives them something to look forward to, like, that's what I'm going to do. And then you can move on with your day and forget about the experience.
Exactly. It so depends on the person, but maybe you need some kind of like release. I would always recommend that people get outside if they can. Exercise. I know we live in Singapore, but just like look at some trees or something.
Yeah.
Like, it's really good for you.
Just from your air-conditioned window.
Exactly. There's so many things like that. Like, if we think about anxiety rather as like a signal to us rather than something that we need to fix, I think there's such focus on, I've got to be like perfect and never feel anxious. Actually, stress is like a very
kind of
valuable, good
piece
of life. Like, we need stress we need some activation in our nervous system to get stuff done and to like live. And so it's valuable information. Like, your brain's number one job is to keep you safe. That's it. Survival. It's not about joy. It's not about, true. That's true. What people want to hear, but it's true. So like, it's keeping you safe. And so, okay, great. Thank you, brain, but I suppose the other thing that is maybe important to keep in mind as well is, a lot of people find this really valuable, is that when we're in that heightened state of stress, when we've tipped over as we tip out of what we call our window of tolerance, and then as we go to a more stressful response, where we then maybe are going into kind of like our coping strategies or fight, flight, freeze responses in the nervous system, what happens is that our thinking brain kind of goes offline. So there's less resources to that part of our brain that helps us with logic, reasoning, curiosity, perspective taking. So when you are already in that state of stress, it's very hard to access these strategies because you're
it's
not,
like brainstem,
it's like,
right?
it's brainstem. So you're in survival. So that's why like you have those kind of what we call autonomic responses, right? Like you're having all the signs of like, I just want to get out of here, or complete freeze, which is another one that I'd say if there's like clinicians listening to this, that's a really hard one to spot, because sometimes it just looks like
silence.
they're just chilled, right? Like, okay,
chill.
they're fine. Like they're compliant, but really there's a lot happening inside for those people. So I think you want your strategies and your plans, you want to practice them and use them outside of difficult moments, so that when you are in the difficult moment, that you've either pre-prepped yourself for it,
Practice.
and you've practiced it, so that maybe it becomes more like a motor pattern that you can reach for. But also so that, because if we think about how regulation works, our stresses stack in our nervous system. So throughout the day, what else is going to be stressful in your day? But also the stress stacks. And so we want to almost like let some of the air out of the tire proactively. And then also don't expect that you're going to like think yourself to calm in the dentist chair. That's just not how it works. And there's nothing wrong with you for not being able to do that. That's literally your brain's way of keeping you safe.
And I suppose also it's muscle memory a bit. Once you start doing all these coping strategies, it becomes more like second nature. So it's easier to access it. Whereas if you've never done that before, you're not going to be able to cognitively go into that strategy.
And some of it we already use. Like one that I didn't mention is trying to actively extend your exhalations, which I know is sometimes hard when someone's up in your mouth, but like but maybe just before, or maybe depending on what work you guys are doing, that you can't, if you extend your exhalation, what happens is your heart rate goes down. And so you are signaling safety to the nervous system. And so like I've been practicing breathwork for many years, but specifically that strategy of like really just extending my exhalations. And now it's something that I notice I just do. But I was probably doing it before as well, because what do we do when we're frustrated? We sigh.
Yeah, that's true.
What do we do when we're crying? We go like, you know, that's the sound of crying almost, right? There's something called the physiological sigh, which was created by Huberman. I never know how to say his name. But it's a double inhalation. So you go, and you repeat that. And that's, I mean, I feel immediately calm when I do that. So, yeah. Sorry, guys, I can really rattle on about this stuff.
I love it. I'm actually picking up a lot of things.
I learned from Jacqueline this thing called box breathing.
Square breathing.
Box
4 in, 4 hold, 4 down, 4 out, 4 hold.
4 hold, and then you keep repeating it over and over
That's
again.
a good one. And there's a visual, right? Especially if you guys have little kids to be doing that
do it on
you
a
can
TV.
have a little print. Yeah, you can have it, and exactly.
Or something,
Or counting. There's another one that people use a lot. I think it's 6, 7, 8 breath.
Like you keep
6,
making it higher.
Yeah. Well, no. So it's 6 in. 6 counts in. I think 6, 7, 8. 6 counts in, 7 hold, 8 out. But I'd say like even if you just do like 2 in, 4 out, it's just about that. It's the exhalation.
And getting the brain to focus on
it's rhythm,
breath and
it's
everything.
counting, it's so many things like that.
I do it as well when I'm nervous.
That's a really good strategy.
And as a clinician, so it's also keeping in mind that like our nervous systems speak to each other, and that's on like a subconscious level. So they can feel your anxiety, and you can feel their anxiety. You must have felt before that you, like if you're treating an anxious person, that you're like, whoa, like what's happening in my body right now? Like, you know, you have
you tense up.
You tense up, and you're like, oh, I've got to be really careful. And then it like, so it's also about like grounding yourself and taking a moment to be like, okay, like and ways that we signal safety to someone by extending our exhalations actively, by getting slower in our speech, more kind of like not using very high-pitched or low-pitched sounds, by like looking at the rate and rhythm of our speech, using our eyes more, like showing kind of which is
You're good.
you're
Yeah,
good,
yeah,
like
yeah,
you know,
yeah,
like
yeah.
sing, and that's that's what we do with kids, is we get low and slow, and we give that like safety to them, and we're all humans need that. We're constantly scanning the environment for safety and danger. So yeah, that's what I would say.
Well, I think those are some really good strategies, and I will be implementing a lot of them after this.
On your patients or
Both.
Both. Yeah.
Well, I have anxiety when I get my blood drawn.
Yeah.
The needle.
Well, because I've
Oh, yeah.
fainted several times from
Okay.
past experiences, and now it's sort of psychosomatic. And so I totally understand when patients are anxious, because I'm not anxious in the dental chair because I know what's going on. But
Unless they're doing something that you're like, what are you doing?
Yeah.
am I a terrible patient? You've treated me.
No, you're really good. Yeah.
I try not to be that person, but it's hard. Usually, dentists and clinicians are probably the worst patients. Actually, they take the mirror and they try to see what's going on.
See what's going on.
Yeah.
You
Then-
must be in control.
Yeah, exactly. Yeah, you
okay.
can't lose control. But I think that's actually, the control thing is a
Yeah.
good point. I think it's some people, a lot of people, most of us, don't like the idea of losing control.
That's everything.
And
I guess
and I think,
the if you want me to stop,
raise your
raise
hand.
your left
Yeah,
hand.
left
So
hand.
Yeah.
totally, yeah, like having
Yeah.
a signal like that to give autonomy and like you say, control and predictability is like a big piece
Yes.
as well. We like predictability, and when there's not, like, that gives safety.
Yes.
So when there isn't predictability, which often there
There is
can't
not.
be,
Yeah.
then at least if you can give some autonomy like that,
Yeah. So
helps.
I think saying we can stop anytime you feel like you need to stop
Yeah.
within
within
clinical limits, but yes.
The other thing I was going to ask you guys about is the block.
The bite block.
Yeah. Is that what it's called? Or the one where you like isolate what
The
you're...
rubber dam.
Maybe?
isolate. You use isolate.
I think I used rubber dam on it. But do
Well,
you
the
feel like
block?
that helps or
Does
doesn't
it
help?
It doesn't let you bite.
Sometimes it makes me more anxious, I think, because it like there's another... But that might not be... I might be anxious anyway, so who knows. But what's the block thing?
The block thing is just to help you stay open in case your jaw
Okay.
hurts.
Okay.
So I actually, that's a tricky one, I find, because, so I do feel like the rubber dam actually helps.
Yeah.
Because you don't have as much stuff in your mouth. So,
So
there's
that,
no one
I
going
like that.
in there.
And
yeah.
it protects also from like the
Things going.
things going
Ah,
in,
the-
and you
the-
feel a little bit more
The
like...
blue thing, right?
Yeah.
Yeah.
And like
So-
you can breathe better? Would
You-
that be...
Yes. Yeah.
Because the breath thing is such a
Yeah,
big part.
because
You
there's
can breathe
not-
with your nose.
There are
and-
not as
yeah.
many things in your
Yeah,
mouth,
yeah,
actually. It's sort of protected from the rest of, the
Right.
environment.
And from a sensory overwhelm perspective, that would make things a little bit easier potentially.
So that, I think
used
that
it before
helps.
myself,
Yeah.
and I think
Yeah.
it's great. Yeah.
But the bite block, actually, I find this is just anecdotal, like
Yeah.
just what I've noticed. But I actually find that it's hit or miss. So what I'll normally do, because you can feel like you're choking, and that's
Oof.
not a nice feeling.
Like you cannot close.
You can't close, so you
Yeah.
don't have control. So some people, if they do have a lot of joint issues or muscle tension, they prefer the bite block.
Right.
Okay, because they physically can't stay open, and they know they need to. So that's one thing. So those patients, what I'll normally do is I'll try it in, and I'll say, do you want this or not?
Yeah.
We can try it, and if
we
it
can
doesn't
take it
work,
out
we can
anytime.
remove it at any time. So I would say it's 50-50, to be honest with that, because I understand where you're coming from with that. And I think one of the things that people really hate about the dentist, and that does make them anxious, is the gagging.
Well, that was the other where my mind went next.
And that's,
Yeah.
and you can't control that.
Yeah,
That is
yeah.
completely involuntary.
Yeah.
I
It's a
personally,
protective, again,
yes.
it's a protective.
I personally have it as well, and it is not a nice feeling, and you're just like, I want to get out of here. So the dental dam actually does help with that a lot because there's nothing going down your throat.
Yeah.
And there are other strategies, like if I've had a couple of patients where the gag reflex is so bad, you can't even put anything in the front of their mouth, let alone the back of their mouth. And what I've done for those particular patients is actually given them anesthetic so that it numbs the throat.
Wow.
This happened when I was still practicing in New York. I had one patient where I actually numbed the entire bilateral blocks, which means that the patient's throat was completely numb.
So both sides of your cheeks.
And
your
he did
tongue, your
he did
lips.
fantastic after that.
Yeah.
Wow.
After that, he was
Wow.
like, "Oh my gosh, this is a game changer. I can
Life-changing.
actually do dental work." Like before, he just wasn't able to do it. So there are things that you can do. And there are strategies, topical anesthetic as well for taking x-rays, for example, because you can't get them to the back of the
I've never
throat.
tried that. Oh.
So there are workarounds, but obviously, you're still going to have the thought in your mind that, this is going to happen. So I
Yeah.
think the regulation strategies before and just knowing that someone's at least going to make the effort to make you more comfortable would
Yeah.
probably make a world of difference.
All the difference.
I know some kids that have that problem with the gag reflex, and then because of that, they don't brush well on the inside, like near the tongue.
Right.
Yeah.
And then it leads to problems. And then I always tell the parents that you should have a mirror there to show them where the brush is going, and at least there's a visual brain
Such a good
connection
strategy.
thing.
Yeah.
And then like, oh, it's not as scary as you thought, because
Yeah.
most of the time they think that it's gonna go really far down their throat or choke you or
Yeah.
something. Yeah. So the mirror really
That's a
works.
Great tip, because I think a visual cue is always nice.
It's-
100%.
yeah. Then you can see that it's like,
Yeah.
okay, I can do this, I cannot do this.
Yeah.
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 But gag reflex makes people
That makes people very anxious.
scared. Yeah.
Yes.
Yeah. And you can understand why.
Yeah. Have you
Yeah.
tried the leg up? That's what they usually
I do
teach
for
in school.
x-rays, yes. So one of the things that you can do, and you would probably be able to speak more to the mind-body connection on this, but one of the things that I try for x-rays sometimes is if the patient has gag reflex, I'm like, pick up one leg and concentrate on keeping your leg up.
Wow.
Because I guess it distracts
it takes
you.
your mind to that.
It actually works,
That's cool.
surprisingly, but it does work.
Yeah.
You
Very,
can get
very
an
cool.
ab exercise while
And,
you're at it.
yeah. And then work on your core
Yeah.
at the same time.
Yeah. Yeah.
Yeah.
Wow.
So I think one of the other things that makes people anxious about the dentist is getting bad news, especially if you haven't been to the dentist in a really long time, which honestly is totally understandable because it's a scary place. And if you already have anxiety and you have been putting it off, the longer you put it off, the harder it is to come back, because I think this idea is built up in your mind.
Yeah.
So I think for patients dealing with that, it's, if you can make it in, you're already
Yeah.
halfway there.
That I always
90%
say,
there.
yeah, like getting started or taking the first step on something is harder most of the time, harder than
like
doing
making the
whole thing.
call or
Making the call, you've
WhatsApp.
already like WhatsApp,
yeah.
even better. Singapore,
WhatsApp
we
is
love
good.
WhatsApp.
And don't beat yourself up if you haven't been able to do it until that point.
Yeah.
Right? So I think one of the things that can happen a lot, which will heighten anxiety, is that you haven't been in a while and you come in and now there's a lot of problems. That's okay. I think you take it one step at a time, little by little, and you sort of over time, some of my patients that deal with this, they do get desensitized to coming in after a while.
You build your window of tolerance can expand.
Yeah.
And the way we build that is through challenges. So like what you're doing by making that call and taking that first step to go is you're showing yourself you have a new proof point, right? Like you have a new point
that
of
you
reference.
reached a
Like
new-
I did that.
Yeah.
And I'd also say that a lot of that's going to have to do with the dentist that you see. Like, are they shaming you for not being there? Right. Like that's, I would say if you're listening to this, like that's a lot to do with that person, and maybe they need to go and like do a little bit of work and reflection, right? Like we're all a work in process. We're all doing the best we can with what we've got. But like, I really, if you can step into curiosity as to why this person has had this challenge, like, I mean, I wouldn't be able to say how many things I had to get done when I saw you that first time. Like, it really was then like, no, there's a lot more going on here than having something stuck in your teeth. And we had to have a whole process. And now we're in a really good rhythm. And like, I was at a point where coming for a cleaning was too terrifying for me. And so then, like, you never made me feel shame ever with that.
I hope not.
No, not at all. I only felt like, like really safe. Like, oh my gosh, like, why did I wait so long to do this? To find someone that's going to care for me, right? It's such an important part of your life.
That's probably one of the most important parts. I mean, that's what I look for when I go to other doctors as well, is do I feel comfortable with this person?
Do I feel cared for?
Exactly.
Yeah.
Because ultimately, I mean, our job is to make sure that you are comfortable and that you get done what you need to get done in the least painful way possible.
We don't want
right?
it to be painful.
We don't want it to be painful.
Yeah.
And like, I think also that, and that's perhaps to your point earlier where you said like the dental experience has shifted, like I'm hoping the whole medical field and healthcare is shifting to be more holistic. Like when someone comes to me people come to me for all sorts of random things. OT deals with all sorts of things, but like, I'm never just looking at them for that. I'm sure that you're thinking of them more holistically than their tooth.
Yeah.
You know, it is a whole person that is in front of you.
Yeah.
And so that has to be, you have to hope, like, actually you deserve that as a human being to be treated in that way. So if you haven't found the right person, there's two brilliant doctors in front of me.
Thank you.
But I actually think that to do dentistry properly, you do have to look at the whole person, because there's so many factors. There's airway, there's diet, there's lifestyle factors. And if you don't know what's happening in the person's life outside of their tooth, you're not really doing your job at the end of the day, because...
And I would love to know if there's research. I'm probably going to take a super deep dive on this after this, but I'm going to lose like 3 hours.
3-hour podcast.
Yeah. But like the connection between mental health and dentistry, like not in terms of the anxiety, like that will be tied into it, but also how it would affect. I'm sure there's, maybe even if there isn't a direct correlation, I don't know. There must be, because it's affecting your health.
Oh, yeah. That would be interesting.
Like the other way around.
The other way around from what we're coming at it today.
Yeah.
In a way, like, you know, is there a correlation between mental health and dental stuff? I don't know.
Like dental issues?
Yeah, like, or the other way.
Well,
like,
so there is, obviously, if you have people with depression
who aren't taking care, exactly. Yeah.
People with clinical depression
Self-care
do not.
and mental health in general affects self-care. Right?
Yeah.
So
you can tell when someone is very stressed, sometimes they neglect their physical health because they just forget about diet. They don't eat well, so you're just having
they don't care
what's
for
convenient.
they're not their hygiene.
Yeah. 'Cause they're just feeling a little bit defeated, like they just need to survive through
time.
Past time or something.
Yeah.
Yeah.
And then obviously there are systemic implications with other more general health issues like diabetes and heart disease that are correlated with dental problems. And
it's part of the lifestyle diseases.
Yeah.
So like,
group.
how can you not look at the whole person, right?
Yeah.
So, yeah.
Nikki, I can't thank you enough for doing this. So Nikki also has an Instagram.
I do. That's probably the best place to find me if you're interested in this type of work. I run an Instagram page, mostly about regulation stuff. That's like my area of special interest. And also neurodivergence and neurodiversity, which yeah, we'll cover a lot of the stuff. There'll be a lot of overlap. So yeah, all of the sensory health. Yeah, I share loads of tricks and tips, and a lot about my own experience as well. So
That's great. And do you want to say the name of
my Instagram? Oh, sorry. Yeah, that would be helpful. Nikki Smit Therapy is where you'll find me.
Okay, and then your
put
website
that on
as well.
Yeah.
Yeah.
So my website, my company is called
You know how they display?
click here.
Yeah, click here.
My company is called Project Play, so that's where you'll find more details about my work. But yeah,
Very cool.
Thank you so much. This has been
My
great.
pleasure.
I've
Love chatting
actually
with you
learned a
guys.
lot.
Yeah, me
Good.
too. I feel
Same.
I was just had a lesson on
Yeah.
like the whole
I've picked up a lot of things
Yeah.
I'm gonna implement.
things that I thought were not a big
Tomorrow.
deal. Yeah.
Yeah, that's what I'm here to
Yes.
advocate for.
And thank you everyone for listening or watching. If you have any questions, you can find us on our website, dentaldesignsclinic.com.
If you need a true understanding doctor, and then look for us, call the front desk.
For sure, I highly recommend.
Yeah.
Okay, thank you.